Assalamu alaikum. I am Professor Fatema Begum, Physiology Department of Women's Medical College. Today I will take the class of white blood corpuscles or leukocyte for AWMC 16 students. Today's study plan to know about the white blood cell and the leukocyte, their characteristics, normal count, differential count and genesis, and also to know about the immunity. Let us now know about the leukocyte. Leukocyte is the other name of the white blood corpuscles. They contains nucleus, they do not contain hemoglobin, and they are the mobile unit of body's protective system. They form partially in the bone marrow and also from the lymph tissue. Now the types of WBC, depending on presence of granules, the WBC can be classified into granular white blood cell and agranular white blood cell. Granule means the WBC contain ribosome. So granular lymphocytes are neutrophil, eosinophil and basophil, and agranular leukocytes are lymphocyte and monocyte. We will study differently about the WBC, all the characteristics and types of the WBC. Let us now know about the neutrophils. So what are the neutrophils? Neutrophils are 60 to 70% of the WBCs. Their diameter is 10 to 12 micrometer in diameter. Nucleus have 2 to 5 lobes connected by thin strand of chromatin. Cytoplasm contain fine granules. So these WBCs contain granules. Functions. Phagocytosis. These are the protective function and main function of neutrophil. They can kill the foreign material, bacteria and all the things that enters in our body. So this is the picture of a neutrophil. See, they contain granules and contain nucleus that have 4 or 5 lobes. Then we move on to eosinophil. Eosinophil are 2 to 4% of the WBCs. They also are 10 to 12 micrometer in diameter, and nucleus has 2 lobes. 2 lobes connected by chromatin and large orange granule. Their granules are large orange. See in the picture, their nucleus has 2 lobes and they have orange granules. Now their function. They combat the effect of histamine and phagocytic antigen antibody complex and destroy certain parasitic worms. Then basophil. Basophils are 0.5 to 1% of the WBC. They are 8 to 10 micrometer in diameter. Their nucleus also has 2 lobes. Their granules are deep blue purple. See in the picture, their granules are deep blue and purple color. And what are their functions? They liberate heparin, histamine and serotonin in allergic reaction. Then lymphocyte. Lymphocytes are agranular WBCs. So their cytoplasm doesn't contain granules, and these are 20 to 25% of the WBC. Lymphocytes are of 3 types: T lymphocyte, B lymphocyte and natural killer cell. Their nucleus is round and slightly indented, and cytoplasm has a rim around the nucleus. See, these are the lymphocytes. So the cell wholly contains the nucleus and there is thin rim of cytoplasm around the nucleus. So what is the function of lymphocyte? It mediates immune response, including antigen antibody reaction. B cell develop into plasma cell which secrete antibody. T cell attack the invading virus, cancer cell and transplanted tissue cell. And natural killer cell attack wide variety of infectious microbes and tumor cells. Let us now know about the monocyte. Monocytes are 3 to 8% of the WBCs. They are 12 to 20 micrometer in diameter. Nucleus is kidney shaped and cytoplasm has blue-gray granules. See, these are the monocyte. Their cytoplasm, their nucleus is kidney shaped. And what is the function? Phagocytosis. They also causes phagocytosis, but they cause less phagocytosis than the neutrophils. So what is the genesis of white blood cell? I mean, how white blood cell develop from the bone marrow and the other cells. See in this picture, these are the genesis of the all type of blood cells. I mean the red blood cell, white blood cell and the platelet. We will only focus about the WBCs. See, there is pluripotent hematopoietic stem cell. From the stem cell, there comes the myeloid stem cell and lymphoid stem cell. From the myeloid stem cell, here comes the eosinophil, basophil and neutrophil. And from the lymphoid stem cell, lymphocyte and monocyte comes from the lymphoid stem cell. Now the normal values of white blood cells. So total count of white blood cell is 4,000 to 11,000 per cubic millimeter of blood. Neutrophil is 3,000 to 6,000. Eosinophil is 150 to 300 and lymphocytes are 1,500 to 4,000. Monocytes are 300 to 600 per microliter of blood. Now WBC has some characteristics and we all need to know about this. So these are the properties of WBC. What are the properties? The properties are margination, diapetesis, amoeboid movement and chemotaxis and phagocytosis. We all know about the properties of the WBC one by one. So what is diapetesis? Diapetesis means white blood cell enter the tissue space by diapetesis. Neutrophil and monocyte can squeeze through the pores of the blood capillaries by diapetesis and small portion of the cell slides through the pore at the time. So see, there is neutrophils can squeeze through the membrane. See, neutrophil from the blood vessel squeeze through the membrane to the infected site. So then how they go to the infected site? They go by amoeboid motion. Amoeboid means motion means they can move by the nature of the amoeboid. How amoeba moves from one place to another place? WBC goes one place from another place by amoeboid movement. See, both the neutrophil and macrophage can move to the tissue by amoeboid movement. So how amoeba moves? Some cells move as a velocity of 40 micrometer per meter. So what is amoeboid movement? Amoeboid movement is movement of the entire cell in relation of the surrounding. Typically, amoeboid locomotion begins in protrusion of a pseudopodium from one end of the cell. Pseudopodium means they can তারা হচ্ছে একটা ঘনপথ বের করবে সেল থেকে. The pseudopodium projects away from the cell body and new tissue area, then the whole cell go with the pseudopods. I mean, সেল থেকে প্রথমে একটা ঘনপথের মতো বের হবে, সেটা সামনের দিকে আগাবে, তারপরে পুরো সেলটা সেই ঘনপথের দিকে চলে যাবে, তাহলে তার মুভমেন্ট হয়ে যাবে আস্তে আস্তে। এভাবে অ্যামিবয়েড মুভমেন্টের মতোই অ্যামিবা এক জায়গা ডব্লিউবিসি এক জায়গা থেকে আরেক জায়গায় মুভ করবে। এখন কোন ডব্লিউবিসি গুলি? মেইনলি neutrophil and monocyte, as they cause phagocytosis. Now chemotaxis. What is chemotaxis? WBCs are attracted to the chemical agents that release from the virus and bacteria toxin, and they goes to the chemotactic areas. So what are the chemical substance? Some of the bacterial and viral toxin, degenerative product of the inflamed tissue, several reaction product of the complement complex and several reaction product caused by plasma clotting in the inflamed area. So this is the process of diapedesis and chemotaxis. See, that is the chemotaxis source, and in bacteria or virus liberating the chemotaxis. Then WBC comes from the capillary or the blood vessel, and they move by the diapedesis, go through the amoeboid movement to the chemotactic source. So after entering the chemotaxic source, what will they do? They phagocyte. I mean, they kill or eat the bacteria or virus. How? Phagocytosis means cellular ingestion of the offending agent. Okay, phagocytosis by neutrophil. How it is occur? First step is attachment, then engulfment, then killing, and so how they occurs? Attachment. On approaching a particle to be phagocyte, the neutrophil first attaches himself to the particle. So, whenever a neutrophil wants to phagocyte a particle, they first attach with the particle. Then engulfment. Then, how they engulf? It projects pseudopodia in all direction around the ingested substance. Then the whole part is ingested to the WBC. Killing, how they kill? After engulfment, the microbes are destroyed by their lysosomal enzyme. The cell contains lysosomal enzyme. They kill the bacterial virus. So, phagocytosis by macrophages. How macrophage causes phagocytosis? When activated by the immune system, they are much more powerful phagocytosis than the neutrophil. They can kill as many as 100 bacteria at a time. They also have the ability to engulf much larger particles. So, phagocytosis occurs in 5 phases: chemotaxis, adherence, ingestion, digestion, and killing. Chemotaxis means the phagocytosis begins with the chemotaxis, a chemically stimulated substance movement from the phagocytosis or a site of damage. Then attachment or adherence, as I told you before, adhere to the foreign medical. Then ingestion, the plasma membrane of the phagocyte extends projection called pseudopods, and then the pseudopods attaches together and the particle moves inside the body of the WBC. Then digestion, the phagosome enters the cytoplasm and merges with lysosome to form a single larger structure called phagolysosome. Then killing, the digestive enzyme kills the bacteria. So in short, whenever there is substance in, or a foreign body, bacteria, virus enters in our body, WBC move through the capillary by diapedesis and move to the chemotactic source by amoeboid movement. Then they attach with the foreign body. Then they engulf the foreign body and kill it by the lysosomal enzyme. That is in short the WBC's characteristics. So what is leukocytosis? Leukocytosis means increased number of WBC above 11,000. I mean, whenever WBC count increases in our body more than normal, we call it leukocytosis. So what are the cause? Protective response to stress or invading microbes, tetanus, exercise, anesthesia, and surgery. These are the causes of leukocytosis. And what is leukopenia? Abnormally low level of WBC less than 4,000, that is we call leukopenia. It is caused by radiation, shock, and certain chemotherapeutic agent. So that is all for today's. In the next class, we will know about the immunities.